Place a chair against the wall for stability and sit on the front edge of the seat. Extend the leg being tested in front of the hip with the heel on the floor and the ankle dorsiflexed approximately 90 degrees. You will then flex the untested leg so that the sole of the foot is flat on the floor about 6 to 12 inches to the side of the body's midline. With the extended leg as straight as possible and the hands on top of each other, slowly bend forward at the hip joint, keeping the spine as straight as possible and the head in normal alignment with the spine. Then reach down the extended leg. This protocol is used for older individuals or for those who have functional limitations due to low back pain and poor range of motion that prevent them from getting down to and up from the floor. This test assesses lower body hamstring flexibility. The middle of the big toe in the medial aspect at the end of the shoe represents a 0 score. Reaches shorter than the toe are scored as negative scores, and reaches beyond the toe are scored as positive scores. Record the best score to the nearest half inch. Before testing, the participant should remove their shoes and perform a short warm-up of about 5 minutes moderate aerobic activity, followed by a few select flexibility exercises. It is recommended that the participant refrain from fast, jerky movements. For the Canadian trunk forward flexion test, the participant sits without shoes and the soles flat against the flexometer, the sit and reach box. At the 26 centimeter mark, inner edges of the soles are placed within 2 centimeters of the measuring scale. For the YMCA sit and reach test, a yardstick is placed on the floor and tape is placed across it at a right angle to the 15-inch mark. The participant sits with the yardstick between the legs with legs extended at right angles to the tape lines on the floor. Heels of the feet should touch the edge of the tape line and be about 10 to 12 inches apart. The participant should slowly reach forward with both hands as far as possible, holding this position approximately 2 seconds. Be sure that the participant keeps the hands parallel and does not lead with one hand. Fingertips can be overlapped and should be in contact with the measuring portion of the yardstick of the sit and reach box. The score is the most distant point reached with the fingertips. The best of 2 trials should be recorded. To assist with the best attempt, the participant should exhale and drop the head between the arms when reaching. The participant should breathe normally without holding the breath. The knees should stay extended but not pressed down. This test assesses the flexibility of the hip flexors. The participant must lie supine. The participant brings one leg, the contralateral or the leg that is not being tested, in the direction of the chest just to the point where the lumbar spine is snug to the floor or table. If the tested leg remains in contact with the floor or table during this maneuver, the hip flexors of that leg are adequately flexible. If the tested leg rises, its hip flexors are likely to be inflexible. Record whether the hip flexors in the right and left leg are flexible or inflexible.